Hello and welcome to this special series of episodes called 29 Days of Magic. During Black History Month, the month of February, I'll be interviewing a Black woman a day who's from business and entrepreneurship. You name it, I'm going to have a chat with her. The idea for this is to show off the amazingness of Black women throughout various industries. I hope you take a listen, like, share, review, and be inspired by these incredible stories. Take a listen. Hello, and welcome to this episode of the Reset Podcast. I'm your host, Laura Mignot, CEO of the cultural communications agency, D-Flash. Each episode, I bring a different person from business, entrepreneurship, you name it, and talking about how they're sort of changing the game. And this episode is no different. I am so excited to have Dr. Nneka Edwards-Jackson, who is a pediatric hospitalist, CEO of Kids of Malawi, and Chief Medical Officer of the startup Welfie. We're going to talk about all of their jobs, how she navigates it all, and just does an amazing set of work. It's going to be a great conversation. Take a listen. Hey, Nneka, how are you?
I'm good, thanks, Laura. How are you?
Oh, just hanging out. So the way the podcast works, the first question is always the same, and I am very fascinated what your answer is going to be for this. What was your first job?
Oh, man. You want to go like way back? My very, very first job? Or, because my first job, was when I was 14 years old, and I worked at a fry joint. But my first job as an adult was as a pediatrician only like 5 years ago at Stanford. So I came a long way.
Okay, so let's start at the chicken joint. Okay, so you were 14, probably working illegally. And so what did you learn working at that chicken joint?
I think, growing up as, an only child of a single mom who, always wanted the best for me in terms of, education, but actually never wanted me to sort of get a job so young. She was, always pushed for me to, focus on school and really, try to get me to that next level. But for me, working at such a young age, it really just taught me like the value of a dollar and taught me to be independent and, having my own money, being able to, help my family. It taught me all sorts of things.
Yeah. So you wanted to get your own money, and so you learned the importance of the value of a dollar. But then, how do we get to being a pediatrician at Stanford? That seems like a big leap.
Yeah. I'll tell you a little bit about my journey. After high school, I was able to get into McGill University in Montreal, Canada, and studied there for 4 years, got my bachelor in science, and then was, to my surprise, accepted into Columbia University for med school.
Wow.
Yeah, no, which was like my dream. I think I had always wanted to be a physician and always had wanted to live in New York. And to put the two together was just magic. So I went to Columbia for 4 years, got my degree, actually spent a year off where I did some research abroad in Thailand, got my first taste in global health. And then went to the University of California, San Francisco for residency, where I did my pediatrics residency. I did a special sort of program there called the Pediatric for the Leadership for the Underserved program, or the PLES program, where I was surrounded by not only wonderful pediatricians, but people who were totally like-minded in terms of wanting to, change the world, fight for social justice and for health equity for kids. And then after that, I got a job at Stanford for a year as something called a neonatal hospitalist, which is just a fancy word for a doctor who works in a hospital who takes care of babies. So that was like the first official, real job after years and years of, part-time jobs and, going to school and, being in training. So that was my first sort of real job where I was like, okay, I'm a doctor. Like I have the credentials and now I'm going to work.
Wow. Okay. So that's an amazing story. And I feel like I don't see enough Black women who are pediatricians in and
Yeah,
around. And
yeah.
so how's that been for you in terms of treating your patients and, being a light for a lot of parents?
That's a really good question. I think, I'm always the only Black pediatrician in the room. I think in some ways it can be really hard. In some ways it can be really rewarding. I think it can be really hard, I think because, colleagues, patients, there have been times when, people just don't expect you to, are sort of surprised that you're there,
Like, oh my
or
gosh, you're the doctor?
yeah, or don't even know that you're the doctor, even though you've told them multiple times that you're the
You're the
doctor.
doctor.
Uh,
Right.
but at the same time, on the flip side, I would say, especially like with Black families, when they're like, "You're the doctor," in a way that like
It's like
they're
they can
it's
sigh of relief.
exactly, you're the doctor, and also like a sense of pride. And
Mm-hmm.
and they like look to their child and they say, she's the doctor, and it's like, you can do that someday. And I really like those moments where it's like, they're like, that's the Black doctor who gets me, and also like maybe my daughter or son can sometime in the future be her. I think those moments really make it all worth it.
It's true because, again, one of the reasons I wanted you on the show. Not even lying. That's literally why I wanted you on the show, because I'm like, I don't think I've had a Black doctor as part of 29 days, much less a Black pediatrician. So I absolutely like you're coming on the show. And, so navigating all of this, like, okay, so how do I get to CEO of Kids Malawi and Chief Medical Officer of Welfie? Because don't you also have small children?
Yeah, I have two small kids as well. One who's currently on my lap. We're the queens of multitasking here. So yeah, that's a really great question as well. I feel like, the reason why I came into medicine was because of this passion for helping people who look like you and me be healthier, and to sort of get rid of some of the disparities that we see in health. And I think specifically I went into pediatrics because I feel like there's so much potential in children. And, I really believe that every child in this world deserves the opportunity to live a healthy and happy life. But as you know, that's not every kid gets the same shot. So I went into medicine thinking that that's, by being a doctor, I would help to achieve some of those, lofty goals. But, as I've gone through training, I realized, making those changes, it's hard to make those changes within the hospital, even the clinic, or even in, in public health. I think that my view of what being healthy has become sort of broader and broader. And I've really started to think about more of the larger issues that affect, Black and brown populations, and then how that contributes to poor health. And so I think that, while I've always been a doctor and interested in clinical medicine, I've had these interests outside of clinical medicine. In terms of the positions that I have, so the first one as the Chief Medical Officer of Kids of Malawi, after my first job at Stanford, I ended up getting a job as a pediatrician in Malawi, in the capital called Lilongwe. And there I worked for about 15 months as one of very few pediatricians that served a ward that basically saw over 20,000 pediatric admissions a year, which probably, it sounds like a big number, and it is. And I was struck by, the lack of resources and, how children were dying of diseases like diarrhea and pneumonia that children should no longer be dying of. And also I became very aware of how global funding streams, global health funding streams, don't always cater to the needs of what, the folks on the ground actually need and want. And, I don't know if you've heard, Laura, of like a lot of people now use the term called, or like the catchphrase, decolonizing global health. Have you heard of that?
Yeah. Because it's a disaster.
Yeah, exactly. And, I didn't have the words for it back then. This was like, 6 or 7 years ago, but I saw it with my own eyes. And so when I came back to the United States, myself and some of my colleagues who had worked in Malawi, we started this nonprofit called Kids of Malawi USA, which basically we wanted to be able to provide grants for people like Malawians on the ground based on the needs that they saw, not based on, the needs of some researcher or what we thought was, best for them. So that's sort of why I got it into, I started that nonprofit, Kids of Malawi USA.
You're just amazing. Okay, so you're a Black pediatrician and you're like, you know what? I'm gonna go to Malawi. And then I'm gonna go to Malawi and then I'm gonna help decolonize global health because it's a disaster. Because people realize that it's just, but it's so true, but also so remarkable. And you just are awesome. I just, wow. I guess my question for you is, having come from the US and then going over to see how obviously, global health is colonized around the world. What's been the thing that you've been the proudest you've been able to achieve through your Malawi nonprofit?
I think that just forming that nonprofit itself, to be honest, I think that, we're not perfect. We're still pretty new. We only started in 2017, but sort of the hoops we had to jump through in order to, get the nonprofit formed in a climate where, I think it's really hard to give money abroad without people asking a lot of questions.
Right.
And to be able to form a charity where our premise is that we want to really support those frontline workers in Malawi and give them a little bit more of a say in where the money goes. I think that in of itself was kind of a hurdle. Yeah, because they know exactly. And so I think just getting that, that group of, like-minded individuals together and forming that charity, that's sort of like the best thing that came out of my experience working in Malawi. Because I could have just come back and been like, I'm going to go back and work a ton and, and I'll go back, do multiple mission trips to Malawi and not really like think more critically of
what's actually happening.
Exactly. Yeah.
I mean, I think that's the thing, because I think we see a lot of these like, oh, we're just going to go over to Africa, pick a country and then be colonizers. And like, oh, because we're going to solve all your problems. Yeah. Versus actually the key here is to work with everyone who's actually there, respect their needs, and be of service and not tell them what to do.
Exactly. Yeah.
We're so excited to have Soho Works as the sponsor for the 29 Days of Magic campaign. They're designed by Soho House, and their workspaces to help creative thinkers, businesses small and large, connect, collaborate, and grow. And it's where I'm recording all the episodes of 29 Days of Magic. It's a safe, wonderful and collaborative experience. I'm currently in the Brooklyn location, but they have locations, one else in New York City, in the Meatpacking District, one in LA, 5 in the UK, and they give you that kind of home away from home feeling with all the tools, technology, equipment to help you do your best work. Like I said, it's an amazing location, feels safe. I've been able to meet some really awesome people, which you haven't been able to do a lot because of the fact of COVID. So it's been a wonderful experience being able to record here and help build community. So if you want to find out more information about it, please go to sohoworks.com to get more information and tell them I sent you. And now back to the show. So that's awesome. So obviously, as a doctor in the US during a pandemic, things were kind of crazy last year. How did that affect you in terms of, working with your patients? Because obviously, especially with kids and trying to figure out what's safe, what's not, and whether or not kids may have COVID or whether it's just a flu. How was that for you last year?
Yeah, no, I think it's been a crazy year for everyone, obviously. And, I think there's many points to make about this. First off, the one thing that is sort of, I think we're sort of fortunate for is that kids don't get that sick from COVID most of the time. And so while my colleagues in adult medicine have been seen a lot of, sickness and a lot of death, we're fortunate in pediatrics that, our wards, because I'm hospital based, so I work in the hospital. Our wards, from a medical perspective, our numbers have been down. I think, first of all, because kids weren't coming in sick with COVID. And then I think a lot of the social distancing actually prevented kids from getting other viruses, which then preventing them from even coming in the hospital in the first place. We definitely, at my hospital, we helped out our adult colleagues where we could, taking, older patients that were outside of our normal wheelhouse, which, I was happy to do because it was such a difficult time for them and for everybody. But the one thing I have seen as a pediatrician is the secondary effects on pediatric populations. So the negative effects on mental health. And so while our numbers have gone down for, things like pneumonia or viral infections that might normally bring kids into the hospital, we've seen an uptick in kids coming in with mental health issues, which, there's so many reasons for that. Social isolation, economic hardship, not being able to go to school. And that for me is really, really heartbreaking. And so to sort of circle back, and you mentioned the other hat that I sort of hold. I got involved with the startup Welfie a couple of months ago as their chief medical officer to sort of try to address some of those issues. We are a digital health platform that's helping schools deal with some of these health needs, specifically COVID right now, and trying to help schools reopen safely.
And wow, again, I don't know how you sleep because I don't think you do. You're probably a vampire. Because oh my goodness. But and that's how I ended up connecting with you. I know one of the co-founders of Welfie, and he was obviously singing your praises. And I love what Welfie is attempting to do in this universe, because I know it's so important, and especially for people who look like us, to see people like us at these medical startups.
Yeah.
Because that will give you a level of comfort that you will actually believe that this is legit. I was on a call the other day with a health company, and I was asking, like, oh, well, how does this work for people who are in communities where folks don't have iPhones? Mm-hmm. And people still have flip phones. They still have Metro PCS or Pay Wireless. And he's like, oh, they'll just get a text message. I'm like, mm-hmm. Not everybody can do that.
Yep.
Like, yep. Will you actually call? And they're like, well, why would we call? And I'm like, oh my God. And they've raised gazillions of dollars in funding and all this other stuff. And it sort of pulls my drive more to like help companies like yours grow and shout from the rooftops how good you all are, because you all get it. And as we try to navigate this very difficult universe that we're in with regard to healthcare, and obviously a global pandemic, a vaccine that there is hesitancy around, the more that we can see folks who look like us, who are bringing the God's honest truth to what is necessary and why it's so important, the faster we will be able to get through this.
Yeah. I 100% agree. And I'll just, on that note, I'll say I got my vaccine as a healthcare worker and a pregnant mom. So everyone go out and get vaccinated.
There you go. You just said it. So while you were pregnant, you got the vaccine.
I did. Yep. I was working, and I wanted to be the example, and, I can't preach to everyone else that you should get the vaccine if I didn't do it myself, and I believe that it's safe. So yeah, I went out and got it.
Awesome. I mean, I'm like number 10,784 million because I live in New York and I'm under 45 and I don't have any underlying health conditions. So I'm like, it's going to be like,
You're
I don't
last in
know.
line.
Yeah. I'll be like waiting. I'll be the last person at Giant Stadium. Like, all right, any day now. Hey. And that's okay. Honestly, listen, I think, I think it's really important for people to realize that I just want my life back. I want to be able to go and like go places. So my next question for you is like, how do you navigate this all for your self-care as a working mom, a doctor, and a C-level executive on 2 other companies? Like, what do you do for yourself?
Yeah, no.
Like nothing.
Yeah, I mean, I just pull my hair out all the time. No, I mean, I think for me, on, a self-care level, I think staying active, doing the things that, making time for me, which I think has been hard, especially given the fact that I have a newborn, and also being on lockdown or, not being able to get out and do the things that we normally do. I do yoga at home and, just making that time where I can, have a couple moments to myself, work on me, basically. And I think also just, knowing when to say no. I make sure that my rules are clearly defined and that I know that, make other people understand, like how much I can actually contribute at a particular time.
Your bandwidth.
I'm very clear with those sort of, guidelines so that, I don't feel completely overwhelmed all the time and I don't feel like I'm not doing the job as well as I should be, and that other people don't, feel like I'm not doing the job that I should be doing. So those are some of the things I do, but I will admit right now, it's tough having a newborn.
Yeah, you can also like go on a podcast and just like hang out for 45 minutes. See? Awesome. And so thinking back on, all the amazing work that you've done, what do you think you tell the 21-year-old you?
Oh, wow. I would tell 21-year-old me, don't think that your path is going to be, a straight line. And, I still am trying to find what my ultimate sort of dream job / purpose is going to be. I think I'm getting closer to it, but I think that every step along the way, it is providing me everything I do. It provides me with more skills, more connections. And it's not, I think back then I thought, there's like one path and, I had to follow, do X, Y, Z to get there. And I'm realizing more and more that's not the case. And that people who are, 10 years older than me are still trying to figure out what they want to do with their lives. So
plenty of time.
That's what I would tell myself. Yeah.
And it's so true. It's just like, I mean, if you had told me 10 years ago, like, oh yeah, Laura, you have these 8 different companies that you run and you also host a podcast. And I'm like, I don't talk to people. How is that even possible? Like, I'm really shy and I have a stutter. What are you talking about? But then here I am 10 years later.
Yeah, amazing. Yeah, no.
So, and I think it's just remarkable that that's why I always, ask this question, because it's like, look how far you've come. Like, because I don't know too many women who can run 2 healthcare companies, be a working mom, and be a practicing pediatrician in the middle of the pandemic, and be like, hey, what's up? like that's pretty incredible. So obviously, this has not been the easiest road for you. Talk to me about a time where you had a challenge in your career, and you're like, there's no way I'm going to figure this out, and then you did. Feels like every day.
Yeah, no, that's a tough one. I think for me, the challenges have been like the forks in the road and trying to figure out what my next step should be. There's like a time in particular where I was trying to figure out, what kind of doctor I wanted to be, and meaning like if I wanted to go on and, subspecialize in some sort of, a field that beyond just being a general pediatrician, which is what I am now. And I think, making the decision and like following my heart, because I think, where my heart lies is more in the public health issues and, making the lives of larger populations of children better instead of like focusing on that one patient, that one child. That, it was kind of a challenge to like, make that decision and be like, I put all this effort to be a doctor. Do I want to keep, striving to be the best doctor or like the most specialized doctor I can be? Or should I follow my heart and maybe not be this renowned specialized doctor, but follow my heart? And that was a challenge. And I think I've chosen the right path. We'll see.
You have.
But yeah, well, we'll know in 10 years, maybe.
I would venture to guess that you have, because as I said, it's at this moment we're in a public health crisis, and the people who are going to rise to the top, who are the ones who are going to make the changes, are going to be the ones who see the world from a global perspective and do it with empathy and understanding. And I think that's clearly what you do. You don't found the organization in Malawi and then come back to be chief medical officer of a company like Welfie if that's not your goal. And that kind of, newer thinking, like, for me, as someone who never got involved in public health, and, my mom has been a nurse for 40 odd years. I can't stand a side of blood. So the idea of anything in medicine is like, no, I can't even I've had an IV once in my life and I nearly passed out. And that was like 5 years ago. So it's not going to be me. But the things I can do are like, hey, like I can put things together and be like, here is the people who know what to do here. Go fund them. And, and I think we all use our skills differently. And, I have this great, insane idea about how to do mass vaccinations because I'm an events person. I know how to move people, places, and things. And so from a logistics standpoint, I know how to do that. But I still need doctors to, who are going to be there. Doctors who are going to understand the communities of color are like going to be like, yo, this is still not, I don't know.
Well, let's work together, Laura. Let's go for it.
You're getting an email. Trust and believe. I just thought you were still on maternity leave. That's why I was like, I'm not going to email her until after the podcast. But like for real, because I'm like, this isn't brain surgery. This is just people, places, and things. It's like, I have found internet in the middle of nowhere in Texas and jerry-rigged the empty power plant. I can figure out how to get people shots in the arms. I've lit up an abandoned power plant. And so that's not difficult. But you do need people who, understand technology, but understand the humanity of it all. And I think that's the difference that I'm so excited to see what you guys are doing at Welfie and you yourself are going to be able to do. Because the more we can amplify your voices and say, 1, get the vaccine, 2, wear a mask, 3, when it's your time, get the shot. But also, public health has so many other disparities in terms of, hypertension disease and asthma and all these different things that, the more we can be helpful, the better off we're all going to be.
100%. I love it.
That was my soapbox.
Get on that soapbox, Laura. I love it.
And then last question for you. Do you have a give or an ask for the audience? And so that could be anything from here's a great book I read to go get the shot. It can be anything you want.
Yeah, I think I have to say go get the shot. That's, I think, and I understand it. I understand why people be hesitant. There's so many reasons for us to be mistrustful, but we also need it. And I hope that, seeing folks like me, go out and get it will inspire or make other people feel like it's safe for them. But just go out and get the shot. We need to get out of this, and it's our best chance of doing it.
And a question for you about how do you feel about reopening schools?
Yeah, I think it's necessary. I think, we know that school is so important to kids, not only because it gives them an education. Kids get so much from school. And I feel like people didn't realize it before, but like I'm not just talking about like classes, but I'm talking about like, food and social support and social skills. And we need to get our kids back in school. So I know that there are things that we need to do in order to make it safe for everybody. But if we can open, bars and restaurants, we can also open schools. And I think we need to prioritize our kids and make sure that they have the best start in life. And that starts with school.
It's so true. And the best message we can get, because there's so much. And here, you're just full of amazing advice, and you just know so much. And I feel like there's lots more we can partner on. Thank you so much for coming on the podcast, sharing your amazing story, and being a light and a voice that folks need to hear. I'm so appreciative, especially since I know you have a little one on your lap who's been mostly good the entire show.
Thanks, Laura.
And we'll put all the details in the show notes so that folks can find out more about Welfie and find out more about Kids Malawi, and hopefully donate and hopefully work with you guys in the future. And that is our show.